Welcome to the JOMA Preventative Health Podcast, hosted by the Jewish Orthodox Women's Medical Association. We provide you with up-to-date information on health topics geared towards the Orthodox Jewish community. This podcast content is provided for informational purposes only and is not intended as medical advice or as a substitute for the medical advice of a physician.
Welcome to the Jewish Orthodox Women's Medical Association, or JOMA podcast. I'm your host, Elisa Minkin. I'm a general pediatrician, and I'm really honored and really excited to be here today with Robin Gutman. Before I introduce her, I'm going to mention again that if people have topics they want to hear or they want to speak on the podcast, don't hesitate to reach out to us at health, HEALTH, at joma.org. This topic is about trauma-informed care and what that means, and about trauma. And until the very end, we don't actually talk about the term trauma-informed care, because I learned what it is at the very end. So I hope you enjoy this. I hope you learn about trauma and about one particular therapist's approach to trauma. She talks about CBT, trauma-focused CBT, which is cognitive behavior therapy, specifically focused on trauma. So Robin Gutman, LMHC, NCC, owner of Monarch Counseling Group, LLC, offers professional counseling services to individuals and couples using an eclectic approach that is personally tailored to each client. Robin's approach is strength-based and designed to empower clients. Robin is skilled in treating an array of different focus areas with much experience in working with children and adolescents. Now, treating adults and couples, Robin is able to assist clients in effectively addressing affective, cognitive, relationship, and behavior problems commonly associated with trauma. Robin especially enjoys helping clients enhance their sense of self-worth, establishing healthy boundaries and healthy relationships. Her most recent trainings have included addressing intimacy challenges with religious couples and Imago. Robin's view of therapy is strength-based. She believes that her clients are their own best resource, and that therapy is most effective when a client is open to recognizing issues and willing to implement changes. Welcome, Robin. Thank you so much for joining me.
Thank you for having me.
I really appreciate it. So I really want to spend our time tonight talking about trauma. And the reason I want to talk about trauma is because we've all been through so much, right? Without mentioning the C word. I don't want to mention that word. We're not going to talk about any viruses tonight. But it's been, 2 years of a lot of challenges. Some people have been through some major things, but all of us have been through at least some level of trauma. And as a pediatrician, I see so much anxiety, so much depression, so much stuff that we have to, start working on, both in my patients, especially my teenage patients, and in the parents that I see. Mm-hmm. So I want to have you just start with telling us, I think trauma has become a big buzzword now, and let's really unpack what is trauma, why is it important?
Yes, I would love to do that, because trauma is a buzzword, and I also don't love for it to be overused. Right. So let's figure out what is trauma. Okay, so trauma, I would say, is a wound that isn't healed, which is something that happened, right? So the traumatic response is the response to an unwanted experience. So unwanted experience, right, that's nice and broad. It could be something very big, which would be like a big T trauma, or something maybe more run-of-the-mill, little T trauma, but still an unwanted experience. And so that's a big part of trauma. But I also want to point out that part of trauma is when the good things that should have happened didn't happen. And that would be, let's say, nurturing, right? Mm-hmm. Normally, you would think if parents have a child, the appropriate best thing for the child is to be nurtured physically and nurtured emotionally. And those are the good things that, again, should happen, quote unquote. So when those things don't happen, that's also a form of trauma. So that's not an unwanted event. That's a good event that didn't happen. But both of those things will fall under the umbrella of trauma.
I never thought about it like that it's also things that should have happened that didn't happen.
Yeah.
Wow.
Emotional, like that would be, emotional neglect. And again, some people think that's like so harsh, and I always make sure to clarify, this is not to blame parents or anything like that, but sometimes it does happen that there is emotional neglect, and that's its own form of trauma.
Mm-hmm, mm-hmm. And it's probably also related to your expectations, right? Because I think some people may have grown up really in difficult circumstances, but don't necessarily perceive them as such. And others may have grown up in what looks like healthy circumstances, but they didn't get what they needed or felt they needed.
Yeah, absolutely. Nature definitely plays a role in that. Definitely. And you could have two children from the same family going through, similar, I don't think you can ever say it's the exact same, but fairly similar, parenting styles and circumstances, and they'll respond differently based on their nature. So there is that nature nurture, intertwining. But trauma can technically begin as early as in utero. And that's an important thing to be aware of as well. If anybody experienced something while they were in utero, if their mom was undergoing something stressful. And that's why good prenatal care is so important, because it actually can start as early as that.
Right. I know they've done studies and looked at cortisol levels, and it affects the baby. I mean, the minute we start saying that, I don't want to pile guilt on people, that, I had trouble during my pregnancy and that's why my child has problems. I really don't want to go down that road. Mm-hmm. But I do want to talk about adverse childhood events, because that's another buzzword that I'm hearing a lot, these ACEs, or adverse childhood events. And I really do want to get into the importance of past trauma so people can understand, like, why should I deal with this?
Mm-hmm. Yeah, absolutely. So again, because you said you don't want people to feel guilty, so I want to clarify, it's not about feeling guilty. It's about knowing what happened so that you can go back there to repair. That's the key point of it. Definitely not to bring on any kind of guilt. We don't want to burden anybody. It's more about putting the pieces together and making those connections, because that's the place when we're looking to heal trauma, that's the place we want to revisit when we feel safe enough. So you never want to just, start any kind of like therapy by jumping right into the details of trauma. And that's really important. You can kind of ask for like a brief outline just to get an idea of something somebody may have experienced, but definitely no details. It takes quite a bit of time until somebody becomes comfortable enough to revisit that, because it was traumatic. So no, it's normal for it to be a slow process.
Right. I mean, the reason I said that is because I can imagine a parent is trying to get help for her child who's struggling, and they start asking, well, how was the pregnancy? And they had the mother herself had a lot of trauma. I think we parents tend to blame ourselves for everything. And that's what I meant by, there's so much we don't have control over, right?
Absolutely. Absolutely. Yeah.
Right. So I think that, with anything, I'm sure you're trying to do it in such a way that you deal with the trauma, but it's not a matter of blame. I mean, that may be part of the trauma, right? Like feeling like I went through this and my child suffered.
Yeah. For the parent, for sure. They could be carrying that load of shame and guilt, and that could be their own trauma. But we're not looking to traumatize the parent, but rather, I think if a parent were to come in seeking help for their child, and we would ask them about, how is the prenatal care and all of that, I don't know if that would trigger their trauma. Most likely, they're already feeling something. It might help them articulate it. It might help them pinpoint it or notice it, which really, I think that would be a helpful thing ultimately, because it would help them as well. But noticing trauma or talking about trauma is never about blame. It's only about, again, going back to the origin so we can help make it better. And I think that's really important for anybody to know. Trauma is not about blame. It's not so we can point fingers.
Right. And if you don't look at the problem, you can't fix it. Right? I mean, you first have to identify it.
Exactly.
Right. So let's talk a little bit about these adverse childhood events. Because again, I mean, I've heard the term being thrown around, and I think we understand more about the importance of early trauma in childhood.
Yes. So adverse childhood events, again, could range. There's I think a list of about 20 of them. If you Google it, there's a range of different things that children can go through. And I think that's something that you could technically divide into big T and little t. But I think without getting into the specifics of each one necessarily, again, we can kind of summarize all of them by saying these are all unwanted events that occurred. If, as a child, or even as a teen or an adult, nobody would choose to experience any of those things on the list. And I think it also underscores the importance of childhood and a healthy childhood, right? Healthy brain development, the emotional responses of the people in one's life that support the child. So if somebody experiences an unwanted event and then doesn't have that supportive network, that's where there's going to be some sort of response being born out of it.
And again, why are these events, why are we paying so much attention to them? What's the significance of them?
They typically impact somebody somehow. And there's a whole, again, if you Google, let's say PTSD, right, there's going to be a whole list of symptoms. And so if somebody undergoes an adverse childhood experience or any kind of unwanted event, and I just want to clarify also, sometimes people find that because trauma is such a buzzword and they don't necessarily want to feel like I had a trauma or I experienced a trauma. So sometimes I like to use the word experience because it's a little bit more palatable. Because we all have experiences. You can't, you can deny trauma, you can't really deny experiences. So sometimes that just sounds a little bit more like easy on the ear. So I'll kind of go between the two. But when people have any kind of unwanted experience, let's say, they will develop a kind of response. And if you look at the list of, PTSD symptoms, which anybody can Google, let's say hypervigilance is on there, right? Hyperarousal. These things creep into people's lives and end up having an absolute effect on their sense of self, how they show up in relationships, how they show up, to the world at large. And so that's why we want to pay attention to them, to the events, is because they definitely have some sort of effect on a person that is likely not standing them in good stead, at least not long-term. Sometimes a person can have like a short-term response that can be helpful. It feels helpful in the moment, but long-term it's not helpful.
I want to go back a little bit to big T and little t, because we're throwing the term around, but we really haven't defined it. What is big T and little t trauma?
So big T trauma would be, let's say, I'll just think of some examples. Let's say going through a war, right? That's a big trauma, or being involved in a bad accident. That could be a big trauma. A smaller trauma might be maybe a more mild form of bullying, right? You didn't go through a war, like, so some kid was mean to you, right? You can kind of downplay it. Like, okay, the kids used to not be so nice to me at recess. Like I didn't, I wasn't in a war zone, right? So if you think about those two, but with trauma, it's not really about comparing. And I think it's good that you brought up big T and little t. It's not about comparing, because I also would never want anybody to downplay their trauma, because the end result is the same. The impact that comes out, if you have PTSD from a big T trauma or a little t trauma, it doesn't really matter. It's hard to measure emotions and it's hard to measure responses. But what can come out of either of those events is the same symptoms of, anxiety or depression, like these symptoms that can come up following the events. I think that's the main thing to focus on.
But I think also that it can be the frequency, the intensity, and the duration of the little t trauma. So say you could have had one big trauma that you might be able to recover from possibly more easily than something that is just relentless. Like bullying, sometimes people get bullied, any individual event might seem to not be that big a deal, but they're getting bullied for years or abused.
Right.
I shouldn't say that. That's a big T trauma, forms of abuse. And the other thing is, of course, I said it before that, it can be subjective, whether it's big T or little t.
Yeah, right. I think so. That's why when you're saying like, some people will experience it one time and come out of it, but it depends so much on the person's nature too, and what else is going on in their life and what kind of support they have. So there's so many factors that play into it. And so I would encourage anybody who feels like they went through something difficult to not compare it or downplay it or minimize it in any way, because if somebody experienced something that was challenging to them and they're noticing in their current life that they're responding in a certain way, maybe they get angry really easily, maybe they call themselves, spaced out or whatever the current trending word for that is nowadays, but that might be dissociation, so that's why I keep saying that I think the outcome is more important to focus on than whatever actually may have happened, and deciding what category it falls into, whether it's a big T or little t. At the end of the day, if it was an unwanted event, there's probably some kind of baggage that you're now carrying because of it.
Right. And again, when you say PTSD, I mean, I think a lot of people do think of trauma equals PTSD. And then again, you're thinking sort of like big T or, a relentless little t, multiple little t trauma leading to the full blown post-traumatic stress disorder, which you mentioned a lot of the symptoms of. Mm-hmm. And I think that we're talking more about trauma in a wider sense with other problems besides full-blown PTSD, because I don't want people to think, okay, well, I don't have PTSD, therefore I haven't really had significant trauma, and therefore my symptoms are not related to trauma, when that's not necessarily true.
Yes, exactly. I want people to be aware that their trauma response might be showing up in little ways, like in their day-to-day lives. They might not even be relating it to trauma. And I also want to add a disclaimer, because with that, I imagine people will say, oh, therapists are always pointing everything towards trauma. So first of all, being trauma trained, yes, I do see most of the world through a trauma lens. And I do think that a lot does stem from, again, even if you don't want to name it trauma, a lot of our reactions do stem from unwanted events, right? If somebody grew up with their mom yelling at them all the time, right? That's not a world war. That's not a house being flooded. It's not a terrible catastrophe per se. It's not going to make the headlines, but it's scarring to a person to have to deal with that. And it impacts the way they relate to their spouse, to their child, to their boss, to the people in their lives, right? And they might not realize, like, why do I talk this way? Why do I act that way? It's just the way I am. It's not necessarily just the way you are. If you uncover it and you think about, well, what is it doing for you? What is your response? If you speak harshly or if you yell at the people around you, how does that serve you? Does it make you feel powerful? Does it make you feel like people are listening to you? Where does that come from? Right? And then we can replace it. What do you need? What do you really need? Do you need to feel heard? Do you need to feel loved? Right? And then we can go a layer deeper and say, okay, well, let's address that. So it can definitely show up in day-to-day behaviors, and it's worth paying attention to.
Right. So again, how would somebody know? Like, again, if you're thinking of the full-blown PTSD and flashbacks, and panic attacks, like that's clear cut. That's the most tip of the iceberg. But what other things, what would people be seeing or feeling that would let them know that maybe they should be focused on trauma?
That's a really good question. I think any behavior or pattern that shows up in a person's life, if they could take the time to uncover it, they might realize that it's rooted in some kind of trauma. So in the work I do, it shows up a lot in relationships. Again, either between adult children and their parents, harboring that resentment. That would be, I guess, like the second type of trauma that I mentioned, like maybe the not having had the good things that should have happened. So there's adults that come in talking about, that aspect of it. Just that feeling of like, it's showing up in relationships. It's making me angry at people, or it's making me feel really sad, or I don't really know who I am, or maybe I yell at my children a lot, or maybe I just feel terrible in crowds, or I'm really insecure, or it can come up in all of these ways. And a person might think, well, I'm insecure. That's not a trauma, right? But they don't realize that, well, maybe if you were always talked down to in a certain way and had some form of emotional abuse, which again, a lot of people will think, well, that's really harsh. It's not emotional abuse. But again, without blaming anybody, and everyone's parents did the best they could, if that's what somebody experienced, that's what they're going to have to nurture within themselves to heal and repair it.
I'm still stuck on how would they know, right? Because if you haven't uncovered it, it's buried.
Mm-hmm. I don't know if there's a way that a person could for sure know on their own. That's why I'm saying, if they notice something happening, if they notice a pattern in their lives, it's a good idea to go and speak to somebody about it to see if they could uncover it, instead of staying stuck and saying, it's just the way I am. It doesn't have to be just the way you are. There might be a reason that you are behaving this way. So anybody who feels stuck in any kind of negative pattern at all, whether it's within themselves or in their relationships or however it's showing up, I think it's important for people to realize it may be rooted in trauma. So if you feel any kind of dissatisfaction, it's worth exploring it, because likely you don't have to live like this forever.
And I would presume that, and we'll talk a little bit about the kind of trauma-focused therapy that you do. Anybody who does that therapy would do other forms of therapy, correct? So that might start with regular, say, CBT, and then be uncovering trauma and then move on to the trauma-focused CBT, correct?
There's so many different modalities out there that I will say it's hard to say for sure, because I think there's a lot of things that could be helpful. That's the truth. And I think
So let's talk about that. You have trauma. What should you do about it? What are the different modalities?
Okay, so I would say if you feel like something's off, you feel like you don't want to be living this way anymore, you want to heal, right? So just to start off by seeking help. If somebody doesn't want to look for a specifically trauma-informed therapist, they don't necessarily have to. Any good therapist who feels that their client is experiencing some form of trauma would hopefully refer, because that's what therapists should do. If they're not trained in a certain, modality or a certain aspect, definitely refer out. And so that would be the first step, is to kind of seek help. If somebody knows specifically that it's probably stemming from some kind of trauma, then it probably is a good idea to look for somebody who's more trauma informed.
Mm-hmm. And I just want to make the point, it's just a basic advocacy point, that if you're in a therapeutic relationship and it's not working out, move on, right? That, you're your own best advocate. And there's so many different therapists, part of it is just sort of like, like a shidduch, right? And part of it is the technique.
Yeah. So I want to also say with that, I completely agree. Mm-hmm. If you feel like it's just not a match, move on. On the other hand, sometimes if people are a little bit scared to delve in, I wouldn't want them to use that as an excuse either. Right. Because I've heard that happen, people would say, oh, I went to this therapist and I don't know, it just didn't work, but they can't really say why. Not that you have to say why, you're entitled to, do whatever works best for you. But I am aware of this concept where people will pull back because it's too scary. So just to be really honest and vulnerable with yourself and ask yourself, is it that I don't click with this therapist's personality, or am I kind of scared of what we're going to uncover? So just be honest with that.
Right. That's a really, really good point. So can we talk about the modalities?
Yes. So a couple of modalities that are out there. So EMDR, I'm not EMDR trained, but EMDR is a big one. The one that I was trained in is TFCBT, which stands for Trauma Focused Cognitive Behavioral.
Wait, I just want to mention what EMDR stands for, which is eye movement desensitization, and I can never remember the R. I did talk about it a little bit with Gelly Asofsky, who's a play therapist and is an EMDR trained therapist. So you can go back in my podcast if you want to learn a little bit. And I believe I will be interviewing someone more extensively about EMDR. There we go.
Good. Yeah, because there's different modalities out there. So it's good to know.
And different things work for different people.
Mm-hmm. Yeah. And okay, so I'll focus on the one that I'm more familiar with, which is the TFCBT.
Fair enough.
CBT is pretty big in the therapy world. It's like a very general model, cognitive behavioral therapy, the idea of thoughts, feelings, and behaviors being related to each other. So with the trauma-focused aspect of it, you're doing that, but with a focus on the trauma. And there's a lot of talk that's involved. The talking is to help people recognize patterns, right? When people share through talking, they're recognizing patterns, or their therapist is, gently pointing out patterns that they may be noticing, or negative beliefs that might be keeping them stuck. And so that's an important component of it. Even prior to that, I would say, is noticing if there's any reactions, physical reactions in the body. So, for example, if somebody was in a really bad car accident and they were driving a red car and they were in an accident with a black minivan, right? They might not even notice that whenever they pass a red vehicle or a black vehicle, that maybe their jaw is tight or their shoulders are tensing, right? Like they may be feeling it somewhere in their body. Maybe their stomach starts to hurt or whatever it might be. Maybe their head, somewhere in the body, there's this response. And so that's interesting to notice in oneself in different situations, just to get to know yourself. What am I feeling? How do I feel? Or if you feel like I'm so angry right now, to notice, okay, where do you carry anger in your body? How do you carry jealousy? How do you carry sadness? What happens to you? So that's part of the exploration, is getting to know oneself, which I think is really important. It's an important part of being able to heal. Again, it's getting to the root of it. I guess the somatic aspect, so to say. So learning about emotions. These are I guess, the baseline things that we would start
Building
with.
blocks.
Yes, exactly. Learning about emotions, feelings identification. And it may be surprising to some or not to others, but feelings is like a big one. There's a lot of people who struggle with identifying their feelings. I mean, people know when they're like happy or sad, but like the real deeper feelings, there's a lot of emotional neglect out there. There's a lot of people who are busy and they just don't have time necessarily, or energy or patience, or they have their own trauma, and it's hard for them to hold, the emotions of those around them. And then people end up getting neglected. And so it's a cycle that's being perpetuated. And so if somebody's able to sit with their own emotions and learn about their own emotions, that's already a step in the right direction.
That's huge. And I want to talk about dissociation, because you mentioned it very briefly before. And if you could explain to us what that is, and I'm guessing that can be playing a part with a lot of people not being aware of their emotions.
Yeah. So there's two types of dissociation. One is when a person is maybe in a room and they feel like nobody, like they kind of dissociate, they disconnect from everything that's going on around them. It's too much. The senses kind of get flooded.
They're shut down.
Yeah. And the other one is kind of more of like an out of body experience almost, where a person feels like they're watching themselves. But they both fall under that umbrella of dissociation. I believe they have two different names, which are escaping me right now.
Okay.
But I do want to say that it's very interesting. What I was saying earlier was sometimes there's a coping mechanism that actually helps in the short term. And dissociation is a great example of that. If somebody's experiencing something like sexual abuse, or on a different scale, bullying, right? The brain kicks in, and the brain will make them dissociate in order to protect them, because otherwise it would be like an overload, just an overload. So they dissociate, and that's helpful for them in that situation. Now, if a person carries that through their whole life, this sense of being like detached from themselves or detached from people around them, that's not a great way to live life. It was a very helpful response in a moment of terrible crisis. Yes, it is not helpful to carry that through for one's entire life.
Right. And what happens when you do that?
If a person does carry through,
dissociate, right?
Yeah. It impacts their quality of life. It impacts their relationships. It impacts them as a person. And that's unfortunate because, again, if we go back to that idea of trauma being an unwanted event, you never even wanted this to happen. So don't let it, affect the rest of your life.
You
don't have to carry it. Yeah.
Right. So I think that's really, really important. I think that one of the things I wanted to talk about is how we have trouble forming attachments because of the disassociation. Is that true?
I would think so. Yes. Yeah. I think a lot of the work I do is with relationships, and I think it ties in very well to trauma, because when people go through trauma, they have a hard time doing really well in relationships, because I think we were talking about feelings, that feelings is a building block. And if you have a hard time identifying with your feelings, it's definitely hard to be vulnerable with your feelings. That would be needed in a close relationship. So, and without close relationships, it's really difficult to thrive, right? Love and belonging is one of the needs of mankind. So it has an actually really large impact. So feelings is a really good place to start. Knowing different feelings words. I often recommend looking up a feelings wheel. I feel like I'm referring to Google a lot, but it's a good idea to Google feelings wheel. We may as well, use technology to our advantage, and kind of getting familiar with the different words that are on that feeling wheel, seeing if they resonate, or learning about them, and opening oneself up to new words and new concepts, and seeing how comfortable you can be with feelings. It's a good place to start.
Right. I'm wondering though, I'm sort of thinking about it as when your foot is numb because you fell asleep, right? And then it wakes up and it really hurts. And I'm wondering if that's why some people run away from it. I mean, do you find that there's a problem with the intensity of the feelings once you open up to them?
Yes. If it's not done in the right way, yes. And that's why also if anybody were to go to a therapist and jump right in and say, I had this terrible trauma happen to me, and they go right into it, that's not safe for the neurological system. The body and the brain cannot do all of that processing. So that's a great point. I think learning feelings is a good cornerstone. And after that, I would explore what happens when you have this feeling, even before getting to the story part, even before addressing that, right? We're talking about general feelings. We're talking about what happens. What happens when you get angry? Where do you feel it? What happens, right? Let's talk about intensity of emotions. Let's talk about what would have to happen to get you to a level. We're talking about, say, 1 through 10. What happens at level 1? What happens at level 2, 3, 4, and so on. And so really getting a person comfortable and familiar, not only with the feelings words, but also with their sensations in the body, where they feel it and how they can control it. And then we can also talk about regulation, emotional regulation. That's a component too.
Right.
Okay, so if we want to, so now you told me, about level 1 through 10. So if you're feeling level 10, what can we do to get you to an 8? What can we do to get you to a 5? Right? And practicing different techniques, because everybody's different. So everybody's going to need different, sensory input or stimuli or whatever it is. And so relaxation techniques is a big part of that too.
Do you work with a psychiatrist who gives medication at the same time ever? Because I'm wondering whether some people get stuck because they just can't handle it.
Medication definitely plays a role. Mm-hmm. It can play a role. I would never
generalize, right?
Generalize. I would never either send somebody as like the first, tell somebody, oh, you must be on medication. But if someone's trying and putting an effort and they're feeling stuck and they can use it as like, a helping hand on their journey, then it definitely has its place.
Right. Because some people will say, well, medication is just a Band-Aid, is just covering something up, and that's why you need therapy. I tend to look at it as whatever works for that particular person.
I would say it's more like wearing glasses. Because I've had people bring that up before with medication and Band-Aid, and it's what's the point? And I remember telling somebody, well, why don't you just take off your glasses? Why do you need glasses? You should be able to see.
Right. But some people will say, you're taking away the anxiety or the feelings that are just coming forth instead of dealing with them. That's why I'm saying I look at it as a more nuanced way, as working together hand in hand.
Right. So I do hear that. So I would say the medication could make the tools that you learn in therapy possible to implement.
Right.
Because sometimes it's just hard to even implement them if it's just too much and you're being flooded and it just feels too heavy.
Right.
So if somebody can take medication and feel like they're in a more manageable place where they can now even learn the skills and try and implement them correctly, and then they can, potentially, if their med provider agrees, maybe wean off of the medication or lower the dosage, provided that the skills are now in place. Because for some people, they'll be so flooded, it's too hard for them to even go there or learn the skills. So they do need it as part of the process. And some people might need it always, and that's between them and their med provider, and that's okay too.
Right. So what is the time frame for trauma-focused CBT?
The time frame is typically, you're saying for how long somebody would have to be in therapy, or how long
treatment? Is there like an average, a range?
Yeah, I think it's an average of, I want to say about 9 months.
Mm-hmm. So it's not a quick thing.
Trauma is never a quick thing.
Right. And is EMDR quicker? I'm just curious. Is EMDR? Because I feel like some people are saying, PTSD, EMDR, quick, done. No?
I don't know enough about that to answer.
Okay, that's fair enough. I'll have to find out more. Are there other modalities besides EMDR and trauma-focused CBT?
So I know something that I'm interested in learning more about is somatic. I think that's an interesting component almost that TFCBT incorporates the somatic part, like the relaxation. I think somatic takes it to a whole different level and really speaks to parts in the body. There's also IFS, which is like internal family systems, which also speaks to, I think, maybe more like the inner child. I'm interviewing somebody, and so stay tuned for that one. Okay. So these might be EMDR as well. I don't remember. Okay. These are all great modalities. These are all, every modality has something to offer. And I will say, in my personal opinion, I think there is a fair amount of overlap.
Right.
So I don't think if somebody goes to one, they're going to be losing out or missing out. They all have what to offer.
It's whatever gets you to healing. Right.
Yes.
What is somatic? that means body, but what does that actually entail?
Yeah. So again, I'm interested in learning more about it myself.
Okay, fair enough.
But I think it's very physical and being very in tune with your body.
It's like a mind-body thing.
I think so. Again, that's my impression of it. And the reason I'm so interested is because in TFCBT, you do incorporate that to a certain extent. And so I'd like to learn like even more, in depth about that.
Right. We didn't talk much about other aspects of adverse childhood events. I mean, the whole concept of how it alters your body can affect you physically.
Mm-hmm.
So that does make sense. And it really is like a whole other topic to be discussed at some other time. But yeah, I mean, I think there's a lot of focus right now on the mind-body connection. So it makes sense.
Yeah, I think with trauma, the key component to remember is that healthy brain development is so important, right? And the brain, when we're talking about the brain, we're talking about the neurological response. The mind and body are so connected that if somebody undergoes an adverse childhood experience that impacts, it's impossible for it not to impact their mind, right? And they will have some kind of emotional responses. Either they'll have negative emotional responses from the people around them or supportive ones, or maybe none, which can have its own negative impact. And all of these things shape the neurological responses. And again, this is what follows a person throughout their life until they recognize it and rewire.
Right. And even throughout the generations, right? We didn't mention intergenerational trauma.
Yes. Right.
It's
intergenerational trauma is so fascinating. It's so fascinating. I think I read this in The Body Keeps the Score by Dr. Bessel van der Kolk. I'm pretty sure this is where I read it, but he was saying how if a woman is, when a woman is pregnant, right, and she has a child in utero, that child already has their own, potential for life inside of them. And so what a grandmother experiences can in fact affect the grandchild, that's incredible to think about how powerfully an event impacts a person. So we're not even necessarily talking about a child, right? If we're talking about someone who's pregnant, it's likely somebody a little bit older. And even at that age, the brain will take in an event and it changes the wiring. It's just incredible to the extent where it has an impact on 2 generations later. It's that powerful.
Right. I mean, I think about it as like psychological epigenetics, right? And it is epigenetics too, right? Because again, the brain and the body are connected, and changes that happen throughout the generations happen in the genes as well. It's wild, really.
It is.
But I'm going to say this. I mentioned to you before. I want to say it because I like it so much that I heard from an interview with a therapist, Esti Marcus, that she said that it's kind of like, Hashem gives the cure before the plague, right? The refuah before the makkah, that just as this intergenerational trauma, that there's also, we have within ourselves as a people, these 3 traits of Rahmanos, Beishanos, and Gemilas Chasadim, that this, ability to be empathic, to be humble, and to do kindness for each other is a preventative. And I want that to be a segue into talking a little bit about resilience.
So I will take the word compassion and kindness, the words compassion and kindness, and I will say, yes, if a person could flip those words from like being kind and compassionate to others, and they should be kind and compassionate to others as well, right. Certainly, but also towards oneself, because this is a very key component in being able to heal. If we're talking about the mind-body connection, and a person is trying to heal, but they maybe think terrible things about themselves. I'm so this, I'm so that, I'm so incompetent, I'm so, whatever fill in the blank words they're telling themselves, that does not help rewiring in a positive, loving, nurturing way. And part of the healing process is feeling emotionally safe so that you can go back and revisit the experience in a better way and heal from there. And so taking that compassion and kindness and turning it towards oneself is a really important piece, I think, that will help in the treatment.
And it's really true, because you could easily say, well, what's the point? Generations back, this has already changed me, right? You can get fatalistic about this intergenerational trauma and epigenetics and all that. And there's always that same potential for getting better. And I'm thinking about how every family has their own dysfunctional dances, right? I mean, I'm guessing that that's related to trauma that hasn't been properly addressed? I'll let you talk more about that. I'm just guessing here.
Yeah. I mean, I think so too. But definitely important to recognize that, yes, if anybody thinks, well, my grandmother went through that and now I'm doomed. Like, no, it's not about pointing fingers at your grandmother. It's not about thinking that you're doomed. It's about recognizing, like, wow, like my family has been carrying this burden and I'm carrying it and I don't want to carry it anymore. So let me recognize where it came from. Let me be cognizant of the way it shows up in me, and I'm going to nurture myself, and I'm going to be compassionate to myself when I notice myself being triggered in that way. So it's really all about noticing and being compassionate and healing from there. So it's really that same loop that you can be caught in a negative cycle.
Right.
Pull yourself out of it. Let's build the positive cycle.
Right. And I love how in your bio, I love how you say that your view is strength-based and that your clients are their own best resources. So I really, really love that, because it still goes back to how you can not only heal from your trauma, but be stronger, much stronger. Yeah,
I really believe that. I think so many people are much more inspirational than they realize. I mean, I get inspired all the time that people who come in. First of all, just the fact that they're seeking help, like,
right.
Amazing. Like, I truly admire that. That is inspirational to me. A lot of people, are out there carrying their heavy burdens on their own and feeling like martyrs, or like that they have to, or that there's no choice. So the fact that you even broke out of that to reach out, to check in, hey, like, I don't like the way I'm feeling when this happens. Like, that's awesome. That's good. That's a good first step. And then even recognizing how they coped with the stressors, with the struggles that they have until then, right? Let's pull from those incidents where it was tough and you made it through. Like, let's pull from that, And I do think people are have an amazing resilience built in, and we just need to, like, uncover that.
Uncover it, right? No, I really, really love that. That is absolutely awesome. Do you take care of children also, or just adults?
Right now, just adults. I started off working with children. TFCBT is actually official, I think, scientifically proven, like, up to age 18, and you can use it afterwards. But the initial studies with it were done with, from the 3 to 18 group.
Interesting. I didn't know that. I still think, though, I'm putting on my pediatrician hat again, that, I always think about how important it is for parents to take care of their mental health so that they can be more effective as parents. Like, a lot of times you think, well, I don't have time to do this now. I have to take care of my kids. I have to be focusing on their needs. But I think it's an awesome way to both take care of yourself and take care of your kids, to get help for yourself.
Mm-hmm. Yeah, definitely. And sometimes I would tell parents also if they need to emotionally regulate themselves, right? So if they learn that, and they can even model that for their children, and they can say, I'm feeling so stressed out right now. I don't like the way I'm feeling. I'm going to lay down on the floor and do a stretch so my body feels better. They don't have to run into their room and do, like, they can model that to their children. Or I'm going to take some deep breaths right now. Or, when I listen to music, it makes me feel a lot better. So I'm going to sit on the couch now and turn on some music. Whatever they're doing for themselves, right? To normalize emotion, to again, model emotional regulation. These are things that parents can do for themselves with their children too.
Right. And it's not only that they're healing themselves, is they're teaching their children at the same time. They're taking what they might think is a weakness and turning it into a strength, not just for themselves, but for their children. Mm-hmm. It's such a myth that parents have to be perfect.
It's such a myth. Children want to see their parents. I don't want to say be human, because smaller children actually do believe that their parents are, like, super powerful. And I think they need to feel that to a certain extent, to feel that all is right in the world, right? So at least to a certain age or to a certain extent, parents do need to model a certain amount of resilience. But that doesn't mean that they can't say, I'm feeling sad, I need to take some breaths. Like, they can be human at the same time, right? They need to be careful not to fall into that, like, codependency or oversharing. Right. So there's always that fine line. And there's always the idea of balance, so I just want to put that out there. But definitely they are allowed to say their feelings and say what they're doing about it. Never to make the child feel responsible to fix it in any way. I just want to clarify.
You did this to me. No. But even if you did lose it, quote unquote, you did lose your self-regulation abilities, you could point that out.
Mm-hmm.
This is hard for me. I'm trying really hard. I don't think there's any age where the child's too young to see that because they saw it already.
Correct.
You either have the choice of modeling better regulation or that you're working on it, or they just see you losing it.
Yes, agreed. Right. If a parent, screams at their child who's really young, it's okay to go back to them and say, I got so mad that I started screaming very loud, but maybe next time I'm going to try to do something different because I don't like the way I feel when I scream. I want to do something different, and I want to be much nicer to you. I don't want to be screaming at you, so I'm going to fix it. I want to do something different. So kind of telling them like why you did it, and it wasn't, you didn't plan to do it, and you want to do something different next time because
right.
It's not good.
Right, but like you said, it's not that your child is like your co-therapist, and you don't want to have a whole bunch on their head to say I'm sorry, and you can do, depending on your child's age, but it doesn't. You don't have to feel like, I'm just failing at this.
I think the most important thing in the parent-child relationship is repair, is the ability to repair. We all make mistakes. Right. All parents will make mistakes. The ability to repair. It's interesting. The idea of saying I'm sorry to a child is, I think, a little controversial. Some people will say, yeah, you can apologize to your child. And other people will say, well, you can, but don't make the child feel like they have to absolve you of your guilt. Like, I'm so sorry of you. Right. You don't want your child to say, oh, that's okay. Like, it's not okay, actually.
Right. No. But I didn't hear that it was controversial to apologize to your child. How do you not, if you yell at your child, how do you not say you're sorry?
So you can say you're sorry without the expectation of them forgiving, let's say. That's
right.
So
the problem is not right. So the problem is not the apology. The problem is the expectation that this child will be a little mini adult and say, no, that's okay.
Right. So just how you phrase it. I wish I wouldn't have yelled. I didn't like the way I felt when that happened. I didn't like the way I made you feel when it happened. And I'm going to try really hard to make sure that doesn't happen again.
Right.
And and it might, because people are human, but again, to just let the child know I'm working on fixing, like I'm trying to repair it. But that doesn't mean that the child isn't experiencing some effect. So I would encourage parents to be really aware and really to try and fix it. If something is coming up, this is an example of something that's coming up in a relationship. Again, relationships happen, in all different ways. If something is coming up and a child is getting yelled at and the parent doesn't mean to yell, it doesn't mean you're a bad parent, but let's address it because it's not really fair to the child. The child does deserve to be nurtured in a healthy way. So
Right. And I want to point out that I did another episode with Robin or Tzipora Kozlowitz of the Post-Traumatic Parent, and we talked a lot about parents and attachment and trauma of the parent. So there's a lot there for people to listen to complement this. And I really want to thank you so much for doing this. We could be talking about so many different aspects of this. There's no end to it. But I'm really glad that we did talk about this. And I want to know how people can find you.
Sure. So, and there was one other thing I wanted to add, if that's okay.
Yes.
And then I'll go back to giving my info, but because I know we had mentioned about trauma-informed care, and I want to just bring that up as far as, across the board, if people go visit doctors and they have experienced some kind of trauma, that's a really important thing to bring up in this context as well. Yes. So, for example, if somebody experienced a sexual trauma and then they are taken, their mom takes them or they're old enough to take themselves and they go to a gynecologist, they might have a terrible reaction. I remember somebody telling me that was like terribly painful, and her mom kept saying it's really not a big deal. It's not painful. Like she's having an examination, and the mom was like, this is not a painful procedure. And to that person, it was. So obviously, there's also physical reasons that it could be painful, but there's also emotional reasons that an examination could be painful. And even though to a non-trauma informed person, they might think like, wow, this child is making a really big deal out of something that's pretty straightforward. But if something happened to the child involving a certain experience, a certain body part, being trauma informed takes into account that we might not know what's behind the scenes, and to be really sensitive to the reaction and response that we're getting, and to understand there's likely a deeper reason why, and to not brush it away and say, oh, you're making a big deal out of nothing. They might be making a big deal out of something. So let's explore that.
How does trauma-informed care differ from just being sensitive?
It might not, but it's hard to say, oh, you should just be a sensitive person. When you bring the idea of trauma into it, it helps people realize, oh, trauma is a real thing. Maybe this person experienced something I don't know about. So you can call it sensitive care, but I think when people think about trauma, it just helps them be more specific in what they're looking for or what might have happened.
I mean, but does trauma-informed care mean that you do something differently than be sensitive to the person's reactions at the time? I mean, it could be coming from sensory integration disorder. They might find something more painful than you would without a prior trauma. That could be causing the trauma. So if you are sensitive, it's not really trauma-informed, it's being sensitive to people being neurodivergent, for example.
So it might be a good idea for people to keep that in mind and ask before they conduct any kind of, even if somebody's going for an eye exam and the person's going to close the light the doctor might close the light in the room, they might want to ask first, or just let the person know, I'm going to close the light. Are you comfortable with that? Just being very aware to all the nuances. If you are aware of trauma reactions, you might be more aware of what to be careful of. Asking somebody to close their eyes could be very triggering for someone. For somebody who experienced a trauma. So there's things that people find triggering because they experienced trauma. And so if practitioners are aware of the triggers, then they're able to provide more sensitive care.
Mm-hmm. I still think that overlaps a lot with being sensitive to the needs of the individual patient. But that's good to understand that better. And I want to know how people can find you.
Sure, yeah. So I'm on Psychology Today.
Mm-hmm.
And I'm on OK Clarity. I'm on Instagram. So those would probably be the best ways to reach out.
So people should reach out to you directly. There's no particular website or email?
No particular website. The email will be linked to Psychology Today or OK Clarity. So I'll kind of link anybody up. Anybody who has any questions or wants to reach out in any way can go through any of those mediums.
Amazing. So I thank you so much for doing this with me.
My pleasure.
Be well. Have a good night.
All right. Thank you. Bye-bye.
You too.
Thanks for listening to the JOMA Preventative Health Podcast. If you've enjoyed this, please rate and review us on Apple Podcasts and share this with your friends. For more information, check out our Instagram at JOMA_org. Check out our website, www.joma.org, that's JOWMA.org, or email us at health@joma.org.